as Richard said, I work in the Liverpool Public Health Department of Liverpool City Council. And over the past 18 months, as you might expect, we have been significantly busy with the impacts of COVID and trying to provide services and support for people to address the range of problems that COVID has presented for people. So I want to start today by just giving you a brief overview as to the way in which this session will run. I suppose to start off with, what I want to do is give you a bit of context and basically start by telling you that the impact of COVID over the last 18 months has seen demand for mental health support increase by 31% on top of what it already was. And that probably come as no surprise to you guys in the third sector who are working with people affected by COVID every day of the week. This extra demand will extend over 2021 and beyond as issues ranging from anxiety in returning to work or public spaces, unemployment, debt issues, loneliness, complicated bereavement, and PTSD related to COVID incidents continue to emerge. Now, a wide range of clinical services called IAPT services offering counselling support and life advice are already freely available through Merseycare and can be accessed via self-help referral or GP referral. Liverpool Public Health, however, has sought to add additional capacity to the system, and therefore over the past 8 months has been placing and mobilising these investments, which are geared to provide support for people with lower mental health problems such as stress, anxiety and mild depression. Quell and Samaritans, which are the two services we're going to introduce to you today, are two of these investments. Both are free and offer instant access to VCF staff, volunteers and the people that you support who want immediate anonymised support to deal with any mental health issue that they may want to discuss. So to start off, firstly, we'll be inviting Georgie of Quell PLC to firstly walk you through how to access and navigate the Quell digital platform and the features that users can take advantage of. And then Barry of the Samaritans will tell you about a unique offer to Liverpool of a 24-hour callback service for people who would like to book some time to speak to a Samaritan. Each presentation will be around 10 to 15 minutes duration. And when both presentations are complete, what we'll do is we'll then invite questions. So without further ado, can I invite Georgie to take hold of the screen and present the Quell digital platform, please.
I don't know whether Georgie's having some problems there, Ian. Do you want me to step in, okay, just in case?
Just to introduce, this is Emily, who also works for Quell PLC with Georgie. And if Georgie's having problems with the screen, Emily's more than capable of navigating.
Yeah, just bear with me because, like I said, Georgie was going to be doing the presentation today, but it looks like she may have been having some technical issues there. So just bear with me a second whilst I get the site up for you. Right. Okay. Fabulous. Right, I'll share my screen. Okay, I'm just going to log out so I can show you the home page. Okay, can everyone see that okay? Does that look all right to you, Ian?
Yes, fine, yeah.
Fab, okay. First of all, yeah, my name's Emily. I work alongside Georgie in Liverpool, so I just thought I'll step in for her just in case. But I was just here to sort of help field any questions today, really. But I'll take you through a really brief overview of the Quell service. So this is what it looks like. This is the Quell homepage. It is quell.io. Some people get a little bit confused. If you put quell into Google, it'll be the first thing that comes up. The only reason it's IO is to do with when the site was set up. It's a lot of, obviously we're digital service at Kooth, so a lot of the sort of big digital companies use IO instead of .com, apparently. As we sort of have a little scroll down, we can have a look at sort of like the various options that we have on the quell site. So we have the join quell button, which is where people will click on to actually join the service and access the support. And then as we scroll a little bit further down, it does sort of link us to the various elements of the site. So maybe if you're thinking about using it yourself, or you are signposting someone else, this is a really good place to kind of like show them what kind of support is available. So we are a safe and confidential space for adults to share their experiences, gain support from an online community, but also access care and support from qualified professionals as well. So we do that through our community support element, our personal tools, our professional support, which is our one-to-one support, and then also our online magazine. There is a little bit more information further down there around things like that we're BACP approved site, and you can also meet some of our team members there as well. Essentially what that does is it takes you through some of the bios around sort of like their experience and their background and how they work on the site. So if we go back to the top and you click on the join quell button, we ask you for some basic information about yourself when you sign up. We are an anonymous service, so we ask for just basic information so that we can support you the best that we can on the site, but also so that we can direct you as well to other local support. So we ask you for the area that you live. So you would go down and you would select, for example, Liverpool, and then the area within Liverpool. Once you've done that, we click on next step, and then we ask you for the year and the month that you were born. Again, this is just because Quell has an age range of 26 plus in Liverpool, and that's because we have our Kooth service, which goes up to 25. So basically anyone sort of 10 plus has access to some kind of support in Liverpool, either through our Kooth service or through Quell. If anyone needs any further information about anything to do with like the age ranges or anything like that, then you can always get in touch with us, and we can make sure, you know, sort of we direct you to the right place. But yeah, you can choose from the list, so it will have sort of the various years there, and then the months, and then you click on next step, and then we ask which best describes you in terms of gender and ethnicity. And again, it just helps us to support you on the site, but also in terms of our reporting as well. Once you've done that, the background comes up, and then you click on next step, and then you're through to sort of like the final stage of the sign up, which is picking a username and a password. So in terms of usernames and passwords, the most important thing is that your username is anonymous. This is because we obviously are an anonymous service and we want you to protect your anonymity. So we ask that you don't put your real name, your date of birth, or anything else that could be identifiable. So obviously, potentially, sometimes people put in like email address, you know, names, or even names that you maybe use for other sites or services. So for example, social media. Just be really cautious about that. Not because necessarily we will come and try and track you down, but obviously if someone recognises your social media name and they're also using the service, then obviously that sort of will limit your anonymity on the site. So we always say just come up with something unique for the site. Once you've done that, these little ticks will go green to say that it's all accepted, and then it's just coming up with your password. Again, it just has to fit the criteria like a standard password on any site. Once you do that and you've just confirmed your password so it matches, you agree to the privacy and safety, so you can go through and have a little read through of that. And then all you do is click on next step. So it is a really simple and easy sign up process. So obviously if you are, you know, signposting someone to the service, it's really straightforward. There's no lengthy forms to fill out or anything like that. It is kind of just a quick 5-minute sign up. I'm just going to cancel that sign up because I'm going to just log in on my test account and just show you what this looked like. So if you just put your username and your password in, then you now have the full access to the Quell service. So you can have a good browse through of all of the different options on here. For some people, they want to go straight through and connect with one of our counsellors in our support section to get that advice and that support. And for some people, you know, they prefer to have a look at sort of maybe the more self-help resources, so things like magazine articles, discussion boards, the goal setting function, things like that. As you kind of have a good scroll through, it does take you through to the various areas of the site. We do have the online journal, which is a good place to kind of track thoughts and feelings, and you can go back and have a look at this in your own time as well. But this is completely optional, and it is a private part of the site. We review your entries just so that we can reach out and ask if you need any help or support, if there is anyone who's reaching out for help on this. But that would only be in those cases where we're potentially concerned for that individual. Anything else, you know, no one else on the site can kind of like see that element. And then as we scroll back up, so you can link to all these various areas, but you can also access them at the top here. So right at the top, this is our online magazine. So this is what I like to think of as part of like the self-help resource. And this is basically, as it says on the tin, an online magazine. So you can have a good browse through all sorts of different articles, either written by our professionals or by other adults who are utilising the service, sort of sharing their experiences as well. There's all sorts of different bits of advice and support on here. As you can see, this is just the sort of new in section. So you know, it can be anything from sort of general well-being to obviously the more hard-hitting topics around things like self-harm, suicidal thoughts, bereavement, all sorts of different things like that. So there's lots and lots on there to have a good browse through of. You can also go to categories and explore categories that you might be interested in. So if there's something in particular that you're looking for, you can find that particular category, say, for example, around, like I said before, bereavement. And then all of the articles are in one place there. So it just sort of helps to narrow that down if you're looking for something specific. You can also post your own articles. So again, it's really easy to contribute and it talks you through how. We do sort of check all of the content before it goes on the site, just to make sure that it is safe, positive, helpful, you know, in some capacity, and also that everyone keeps their anonymity as well. And then we also have a favourite section. So again, if you are maybe wanting to read an article again, or you want to go back and read it in your own time, or you don't have time right now, you can kind of store it in your own section to go and have a look at in your own time. So that is the online magazine. We also have our forums. So the forums is where our adults can essentially have conversations with other adults in a safe environment, an anonymous environment. They can ask for help and support, and they can receive that advice as well. As we sort of scroll through, you can see this is the sort of the content here. So this is from someone who's utilising the site. It has the date when they posted it. And then also on the right-hand side, we have the replies from other users on the site. So this isn't replies from our team. This is just from other users. So you can have a really good look through these. There's all sorts of different things. As you can see, it's a real variety of content. You know, people asking around mental health, physical health, all sorts of different things on there, family life. And again, you also have the categories option. So you can go through and pick a particular category. So for example, health and well-being, disability, and then all the discussions around that one particular place would be there to have a look at. So there's lots and lots to explore in that sense as well. It's also really easy to start your own discussion. So all you do is put the subject and the content. Again, we do check it to make sure that it is safe. And in terms of the responses to the comments as well, we check all of those. So everything on our site is pre-moderated. And that just means that we can obviously guarantee that it's safe, that the responses that people are getting are positive, they're helpful, etc. And you can also follow different threads and different discussions as well. So if maybe you post one, you can also go back and have a look at, at the replies that people are leaving. So you can kind of store those all in one place as well. We also have the goal setting function. So again, really easy way to sort of set self goals. You can complete goals that have been there for a while, and you can sort of score yourself on your goal as well. And you can also get support on your goal journey through our team. We have the journal, so you can go back and look at your old journal entries and sort of see how you're feeling at various times. So you can kind of track that as well. Some people use it as like a daily gratitude journal or something along the lines of that. And then we also have a helpful resources page. This is just sort of national resources, but if you speak to one of our team members, they will link you to local support as well. And then we also have a meet the team section where you can have a look through the bios, as I said, of the different counsellors and the support we have on the site, and also a feedback section. And then the final bit I want to show you is around our one-to-one support. Oh, it's locked me out. Let me have a look. So I click on the wrong bit. There we go. Fingers crossed. There we go. Yeah, so this is our message to the team function and our live chat function. So there's two options here if you are accessing support from our team. The first way is to send a message. Now, this is a really great way to get that initial advice and support. We can help with absolutely anything at all. I think that's the most important thing to take away from this today, is we are there for sort of anything on the sort of lower spectrum of, like, if you've just got a bit of a worry or a concern, right up to really sort of serious concerns or things maybe you've not spoken about with anyone else before as well. And you can send us a message. You send it at any time of the day or night, and we are available on the site sort of 365 days a year, but we do have our service hours end at 10 o'clock each day. So if you send any messages later than 10 o'clock, they'll be picked up and responded to the following day. Every single message is responded to within 24 hours. So it's essentially just like an internal email. And yeah, it's a great way to start that conversation with one of our counsellors and start accessing that support. If you'd rather, you can also get support from our live chat. Now, this is essentially our kind of like counselling function, our sort of emotional wellbeing support function. And as it says here, our live chat is currently closed or offline. That's just because we start our live chat hours every single day, Monday to Friday, between 12 p.m. till 10 p.m. So midday till 10 p.m. on weekdays, and 6 p.m. till 10 p.m. on the weekends. And essentially, as soon as it turns 12 p.m. today, we would have a button here that says request a chat. You click on request a chat. We then know you are waiting for a chat, and as soon as one of our counsellors is available, they will pick you up and engage in a conversation with you around anything at all that you want to talk about. All of our chats are text-based because obviously we are an anonymous service, so you don't have to see anyone. You're not picking up the phone and calling anyone. It is all just completely text-based. And in terms of like wait times, we don't have like a sort of a waiting list or anything like that. It is just a case of you click on the button, and as soon as one of our counsellors is available, they'll pick you up. Wait times do vary depending on the time of day or night. However, I think in terms of quell access and support, you could be waiting 5 minutes for an initial chat. So it is quite a quick process if you are looking for that initial support. So just before I finish, the final thing just to say is the hide page button we have here is also a really good way to escape the Quell site if you need to quickly. If I click on that, it just takes you through to a Google homepage. So if you're using Quell at home or in a private space, then that's a really good way to do that. And if you click on the little question mark, it is a way to talk you through sort of how to keep your visit to Quell private in terms of using internet browsers and things like that. So it's a great way to be able to escape the site quickly. For example, if you are using it at home or you're concerned about anyone else seeing that you're using the site. So I'm just going to stop sharing and come back to Ian, hand back over if that's okay.
Thank you very much, Emily, and thank you for standing in. I think Georgie's sorted the connection problems out and she's back with us, so she'll be able to support any questions that might come out of the Q&A session a little later on.
No problem.
Yeah, really sorry about that.
That's all right,
twice now.
Appreciate there's a lot of information to digest in that presentation, so if I could just ask you to hold any questions you might have. What I'd like to do now is invite Vary from the Samaritan service to step in now and introduce the offer that they have of a 24-hour call back from the service. And then when you've heard both presentations, we can have a further discussion and a Q&A session at that point. So if that's okay now, Vary, I'll hand over the screen to yourself.
Yeah, perfect. Thank you. I'm just going to share my screen now. 1 second. Okay, so my name's Barry and I am the Learning and Skills Coordinator for Samaritans of Liverpool and Merseyside. And so the aim of our presentation today, I'm just going to take you through a brief history of Samaritans, who we are and what we do, the different services that we provide, and why people contact us and the benefits they receive when making contact for our service, and also, of course, about our special relationship with Liverpool Public Health. So Samaritans started back in 1953. It was to act almost like a potential 999 for suicides. It was one man and one phone who wanted to help people to help themselves. Our branch in Liverpool was the second in England to open, and we've been listening for just over 60 years now in the city. We are a 24-hour service, and we were the first 24-hour helpline in the UK and Ireland. Despite our name being after the Good Samaritan parable in the Bible, we are not a religious organisation. So just a glance over the Samaritan service. We have 201 branches across the UK, and we are a completely volunteer-led organisation. Nationally, we do have 20,000 volunteers, and in our Liverpool branch, we have 140 dedicated volunteers, including 3 paid members of staff, which is an administrator, a development manager, and myself as the Learning and Skills Coordinator. However, our listening service is delivered entirely by volunteers who are all ordinary people doing extraordinary things. So Samaritans is a free, confidential emotional support helpline. There is no script for our listeners, and we're not trained therapists. However, we do go through an intensive training course before volunteering. We are there for anyone, including, although not exclusively, anyone who is feeling suicidal. As you can see on the screen, people report a significant reduction in distress after calling us. Our callers value the anonymity it offers them, the undivided attention they receive to talk things through, and the human contact. 74% feel they have options for dealing with difficult situations going forward. 62% feel more understood, and 70% feel more hopeful about the future. So Samaritans receive a call every 7 seconds, and although we're commonly seen as a suicide helpline, only 25% of our calls are related to suicide. 67% of our callers feel better able to cope with everyday life. Our service can help meet a fundamental emotional need and alleviate any distress through the power of empathy and undivided attention towards our callers. 1 in 4 people in the UK will experience some kind of mental health problem in the course of a year, and 1 in 10 of our callers only have Samaritans as a source of support. Our mission is that we make sure there's someone there for anyone who needs to speak. So more about our branch in Liverpool, and we're based on 25 Clarence Street in the city centre, where you'll find volunteers answering calls for help and emails 24 hours a day, every single day of the year. Before the pandemic, anyone could come in and speak to us at our branch between the hours of 10 and 8 p.m. But with restrictions, unfortunately, we've had to suspend that, but we're hoping to resume it shortly. Our branch works in partnership with Merseyrail, Network Rail and HMP Liverpool, where for nearly 30 years we've operated a listening service with prisoners. Before the pandemic, we also had an outreach team that visited Aintree University Hospital's A&E department for staff and patients. So our values shape everything that we do at Samaritans. We value listening and how exploring feelings alleviates distress and helps people to reach a better understanding of their situation and the options that are open to them. We value confidentiality. We believe if people feel safe, they're more likely to open up about what they're going through and how they're feeling. We value being non-judgmental. We want people to speak openly and freely without the fear of prejudice or rejection. We also value people making their own decisions wherever possible. We believe that people have the right to find their own solution, and if we were to tell them what to do, it would take the responsibility away from them. And lastly, human contact. Giving people time, undivided attention, and empathy meets a fundamental emotional need and reduces distress and despair. So there's no typical person and no typical problem that they call us about. We talk to callers about anything from bereavement, financial stress, relationship problems, addictions, loneliness, amongst many other things. We don't talk about ourselves, so we center ourselves from the conversation and dedicate our time completely to the caller. We don't give advice either. Our listeners hear so many different situations on the phones, and we can't be experts at everything. We only hear the small picture that the caller has told us, so it would be unethical for us to give advice and tell them what to do. And of course, we value people making their own decisions wherever possible. So of course, we're offering a callback service in partnership with Liverpool Public Health, and it's available by a simple form, an online link that you can just click and access. So walking through it now, all we request are some basic details. So your name and the name of the person that you're referring, whether if it's someone else or yourself. And we require 2 hours for a window for when you want the call back, just to make sure there is a Samaritan volunteer available to you. And of course, the 2-hour window can be any time of day, 24 hours. So it's essential as well that we receive the contact number, just so we can make sure that we can get in contact, because with the names, you could put an anonymous name or you could put something else that isn't related to yourself. And if we don't have the number, we can't track it back to find you and ask for that information. When our listeners do make contact, it will come up from a withheld number, just for the anonymity. So, and looking through here, and we do request just a brief explanation of what you're looking to talk about on the call, just so our volunteer has an idea on what you would like to discuss. And of course, you can put as much or as little as you want. And of course, we are available 24 hours a day by just dialing 116 123, or you can email us at joe@samaritans.org. As well as this, we're offering training workshops for organisations. We have 3 core deliverable workshops, which are Learn to Listen Like a Samaritan, Handling Difficult Conversations, and Dealing with Vulnerable Customers. So these are the 3 core ones, but of course we can make bespoke workshops depending on your organisation's needs. And for any more information, my contact details are on screen if you would like to inquire about it. And we also have 2 Eventbrite workshops coming up in the summer, which is just a Learn to Listen, a bite-sized piece of one of the workshops that's available on Zoom. So you can request further details on that from myself. But that's all from myself today, so I'll hand it back to Ian. Thank you very much for listening. I'll stop sharing my screen as well.
Thank you, Veri.
No worries.
Okay. Obviously, there's a lot of information in them 2 presentations that you've just heard. So what we'd like to do now is open up the discussion by inviting some questions, and we'll have colleagues from Quell and from the Samaritans try to answer them best they can. So can I invite any questions?
Got the first.
Oh yes, sorry, go on.
Got,
I was just going to say I saw one in the chat.
Yeah, there's a question in the chat from Helen Reynolds, and I'm not sure if it's already been answered, but I'll ask it anyway because it was submitted. Are you, with both services, connected to a counsellor immediately, or is there a wait for a call back? So it might be useful to reflect on some of the things that you've just been said, because there are different pathways for both services.
Do you guys at Quell want to answer that first and let Barry go second? Yeah.
Yeah, so in terms of connecting to a counsellor immediately, there isn't a wait in terms of like for a callback or anything like that, but you are, when you click on the request to chat, there will be a short wait, just dependent on sort of how many of our team are working and the time of the day and things like that. So it could be, like I said, potentially waiting 5 minutes, and then you'll be picked up by your counsellor and have that chat. But it will be in that time that you're waiting there. If you're waiting any longer than 15 minutes, we'll send you a message just to sort of explain maybe why that is, or if it's a really particularly busy time. In terms of the actual messaging, although we respond within 24 hours, it could be a lot quicker than that. So yeah, there's not like a wait in terms of like hours or days or anything like that. It is sort of a matter of minutes potentially.
Thanks, Emily. Vary, do you want to take that from a Samaritan perspective, please?
Yes, so if you were to fill out our form, in terms of once you get it through, it will go straight to our duty room. So potentially if there's a volunteer that's available, they could give you a call back straight away. If the 2-hour window is, say, within the next hour, and someone could contact you straight away. But we do request the 2 hours just in case some of our volunteers are already on the phone or engaging with our other service users. But it can be within the same day that you request that call back, if that helps.
Just to add to what Barry said as well, because I was involved in the setting up of this piece of work, and part of the thinking on the 24-hour callback was that some clients might prefer to have a dedicated space and time in which they could receive that call, so that they didn't, for example, receive it whilst they're watching Coronation Street with the family, or perhaps shopping in the supermarket. And it would also give them some time to think about what it is that they want to talk about. I think reassuringly, from the first 6 months of work that we've done with our colleagues at the Samaritans, we can confidently report that people who do organise a callback, probably more often than not, usually the next day, usually receive that call. So people do not change their mind and decide not to take it. They're usually ready and waiting to accept the call. Can we have the next question, please?
Okay, there's a couple of questions that have just popped through that kind of overlap. We've got, are the training workshops from the Samaritans free? If not, what is the cost? And are they delivered by Zoom or Teams currently?
Okay.
Sorry.
I'll take the first bit and then let you explain it, Barry. In terms of the questionnaire cost, yes, they are free. This is part of a service that Liverpool Public Health want to provide to our VCF partners across the city to improve their capacity to support their own clients. So that's the answer to the questionnaire cost. Barry, do you want to take the second part of the question, please?
Yeah, of course. So in terms of delivering the workshops, we've been delivering them by Zoom, but we can change that over to Teams if the organisation prefers that platform. I've also been delivering the workshops face-to-face in social distancing environments. So for example, last week I did one for the Coroner's Court, and we did that face-to-face, but with Liverpool City Council, for example, I'm doing that over Zoom. So it is dependent on the conversation. We can negotiate what would be best for your team members, or yeah. Thanks,
Barry. Next question.
Got another one here. Just a quick question. Does Quell have sexual health advice or offer referrals such as access to emergency contraception, STI screening, HIV prevention and testing, etc.?
Yeah, so in terms of our referrals, I think, well, the best way to describe it is if someone is talking to one of our counsellors, and obviously their concern is around, for example, having access to emergency contraception, we have kind of like an inbuilt system where our counsellors will have access to all kinds of like local support around a variety of different various areas, whether that is sexual health related. So we will be able to link them to like local support that can help them with that. Obviously that's just depends on whether that individual brings it up within their chat. But yes, we can kind of signpost them to. We wouldn't be able to refer them unless they specifically wanted to give us their details, because obviously as an anonymous service we can't do that. But yeah, we could absolutely signpost them to all sorts of different support in their local area. So yeah, that'll be absolutely fine.
Thanks, Emily.
Brilliant.
Any more questions?
some nice comments in the chat as well. Thank you, everybody. Another question though, are services provided in different languages?
Okay, I'll take that one. The answer to that question for these two services is unfortunately not. I think the Samaritans offers a service in Welsh, but other than that, not. What I was going to come to, but I think it's probably opportune time to talk about it now, is to advise that there are the IAP services that I referred to earlier on. IAP is an acronym for improving access to psychological therapies, and they're provided by Merseycare, and Merseycare use Language Line. So the services that they offer for people who don't use English as a first language are available in a whole range of languages, and they can be accessed, the IAP services, either via self-referral or via GP referral.
Brilliant, thank you. Another question here, and this is an interesting set of circumstances actually. Our organisation is based in Liverpool, but we have staff based elsewhere in the country. So is the Samaritans referral callback service only for those that are based in Liverpool? And if so, is quell available for anyone anywhere? This is an interesting one because obviously we don't all sit with very, very strict purple bin rules with our service users. So like some of us will be like cross kind of local authority areas or some regionally or nationally.
Yeah, it's a good question. It's one that we've been asked before, and we've kind of wrestled with over the duration of the contracts. To give you an answer, both services are predominantly established to provide support for people who either work or reside in Liverpool. Now, if as a service you're working with people who are across the border, so for example, you might have a service that is predominantly operating from, let's say, the old Swan area of Liverpool, but you have clients who are very close and living in Knowsley. They could have access to the service so long as the service provider is based in Liverpool. At the same time, the same applies to your staff. So if you're a service based in Liverpool, but you have staff who live perhaps on the Wirral or in St Helens or the surrounding area, those staff can access the service as well. In situations whereby you have multiple offices elsewhere across the country, we would need to say no to that, because there's obviously capacity limits on what we can provide through each service. We're paid for X number of service hours. So if, for example, you are a service that's based in Liverpool and you have an office in London, that service will be available to your staff, your volunteers, and the people with whom you work with in the Liverpool or immediate surrounding area, but not available to the clients and staff from the London office.
I was just going to jump in there as well, Ian, and just say, if anyone, if that is the case and there are, other areas, further out, it is worth on Quell having a look on the site, because we could have potential commissionings in other areas. But yes, specifically for Quell, obviously, we usually work by the live, work or educated within Liverpool. So yeah.
Any further questions, Richard?
I can't see any further questions in the chat. I'm just scanning screens to see if there are any frantically waving hands. No, can't see any. So I think, oh, hold on a second. Yeah, we've got a question from Sarah Jones.
My question would be, how would you suggest we go about introducing the services to our staff teams, encouraging them to take part?
Thanks for that question, Sarah. You're absolutely right to ask the question, because whilst we're really grateful for the attendance that we've got today, we're really dependent upon you guys then going back into your staff teams and your services and really actively promoting this service. So what we're going to do immediately after this session is completed is forward on to Richard, who will then cascade to yourselves a range of documents which will underline what we've already discussed today in a little bit more detail. So there's a Word document with a brief one-page resume of what both services offer. Secondly, there's question and answer sheets on both services that you can access as well. So that can be cascaded again to your volunteers, your staff, and your users. And then thirdly, we have separate resources which provide the website detail for Quell and the online link for the Samaritan service access as well. So you will have everything in one email that will enable you to cascade that information to people you work with, and for them to then immediately access the service. And I want to underline the word immediate. They can do that today if they hear about it today.
I was just going to say as well, Ian, I don't know whether it's worth mentioning, if there are obviously, if you've got big, or teams that you would like this information to be sort of directly fed to, then from a Quell perspective, obviously don't want to talk for Samaritans, but I'm sure same applies. Georgie and myself are happy to do sessions with specific teams. So if you wanted like an overview of Quell, a bit of a site tour, they can ask their own questions, that kind of thing, then absolutely we can arrange those for you. So do feel free to get in touch with us. We can book them in virtually for your staff to attend as well.
Yeah, that's a good point actually that Emily makes. We have, for example, done similar presentations to the business sector in Liverpool, and as a net result of them presentations, had specific requests from different parts of that sector, like the local hospitality association, Liverpool One, etc., for presentations directly to their members. So again, if you feel you have an audience that would be willing recipients of this kind of presentation, we're more than happy to cascade that further as another option for you if you feel that's appropriate.
Well, we've got a couple more. Paul, you've got your hand up, and then there's just a few more that have just come through in the chat subsequent to that. So Paul, if you'd like to go first.
Thank you, and thank you for the presentations, really, really useful. I was just picking up on the final point I think Emily made in the previous response around educated in Liverpool. I work for Liverpool John Moores University Students' Union, so I assume that they will be able to access both services, but I was just wondering if there was any specific entry points for students. And equally, I'd noticed the age difference between Couth and Quell, and obviously our students will bridge both of those age gaps. So I was just wondering if there was any specific entry, not requirements, but entry routes into the services, really.
Okay, I'll take the first part of that question, Emily, and perhaps you want to add to it. It's a good question that you ask, and it's one that we've been asked a few times already. The reason why the Quell entry point is kind of badged at 25 is because the CAM services, those services that are directed for young people are aged 10 to 24, so it's kind of try to demark that. I've had conversations with a number of people in the university sector, and we're looking to put some further presentations on for the sector as we enter the freshest stage of the academic year in September. I think that the position that we've got in Liverpool is that we intend to be flexible, and we recognise that there will be some students who potentially would feel more comfortable using the site that's moderated for the younger people, but there'll be others who at the same age feel perhaps it's more appropriate for them to access the materials that are more relevant to their age range and older. So there is flexibility within Liverpool on the use of that. Emily, is there anything else that you want to add to that?
No, just to say, obviously, we're happy to have further conversations with you as well around what you feel would be more appropriate. If you wanted to have another separate meeting, we could talk to you about both Couth and Quell and kind of see what your take on that is, because like Ian said, we're happy to kind of be a bit flexible with that and see what you think the best approach would be for students in Liverpool. But yeah, absolutely, they do have access to support in some capacity.
Thanks, Emily.
Hey, we've got another quite specific question. An organisation that's in Liverpool has an office in Liverpool, but they only have one staff member who works with people in Liverpool as well, but they live and work remotely in Dundee. I think they're just concerned that they might not be able to access any of the services.
So just to be clear, I understand what the situation there, Richard, is that the person who works for the Liverpool office is actually based themselves in Dundee.
Yes, it seems to be based on Anna's comments in the chat. Yeah.
Yeah. Well, it certainly wouldn't be a problem for access to the Samaritan service. Now, with the quell service, what, as Emily's already described, we ask is that people put down their the ward in which they're based. All we would ask them to do is presumably, do they have a physical base in Liverpool?
Yes, according to the
Yeah.
question.
Yeah.
Yeah.
So just put down the ward in which the physical office is based.
Yeah, the only reason that we as well obviously ask for a specific area is because if that individual needs further support, you know, obviously all of our signposting will be based off of the location that they've put in. So I think as long as they understand that, you know, if they are looking for further support and they signed up under Liverpool, but they're obviously based in Dundee, they wouldn't be able to get the support for Dundee, if that makes sense. So it's just about understanding that. That's obviously a big part of why we ask for the location, is so that we can extend that further support if they need it, because we don't have any further details from them. But I think as long as they understand that, then that would be okay. Yeah.
Thanks, Emily. Anything else, Richard?
I think it's just another comment here from Scott. Just it would be really useful for copies of the documents and the resources, just so that they can share the information within their workplaces. I think that was kind of addressed, but do you want to just reiterate what's available and what can be circulated?
Yeah, absolutely. As I said earlier, we'll be circulating 5 documents. One is a one-page A4 document which describes, on one page, if you like, both service offers. Number 2 and number 3 documents are the contact details, separate contact details for Samaritans in one document and the quell service in the other. And documents 4 and 5 are Q&A fact sheets on the respective services. So I will forward all them on to Richard, who can then cascade them on to everybody using the audience today. And please feel free to disseminate them as widely as you wish.
Brilliant, thanks. I saw in the chat, I think Kath had a couple of questions, but I think Emily has kind of addressed those in the chat. Just keep scanning down. Okay, we've got another one here. A university based in Ormskirk with many students from Liverpool uses what seems to be similar to Quell. It's an online platform called the Big White Wall and Together All. So more of a kind of like contribution there, I think. So thanks for that. That's really useful, Gordon. I can't see any other questions. I'm just again scanning through screens. Nope. If we draw this to a close and then somebody immediately comes up with a question, what is the sort of the quickest way for people to sort of reach out to you guys just to get? I know you may have mentioned this, but again, things like this pop up, don't they? You have that epiphany moment just after the seminar and you want to ask another question. What's the quickest way that people can get in touch to ask a quick question?
What we can do is we can provide you with the email addresses. In fact, they might be on the fact sheet, Richard. I'll check all both services so that inquiries can be made that way. I think the other thing I just want to say before we close is that there will be others who, as a first step, might want to seek out reliable self-help resources as an alternative to accessing the service. And for those people, we'd recommend the Kind to Your Mind page on the Live Your Life website. That's a Liverpool Public Health website, and the page is rich in evidence-based self-help tips. So whether it be low mood, low energy, feeling stress, trouble sleeping, or generally having a fuzzy head, the page recommends small changes that can help you to feel good. So what I'll do is I'll provide you with a further document which has that site's web address and some of the details of the IAP services that I've also referred to. And in closing, I'd just kind of like to, again, one more time underline the real importance that you guys take this information away and really cascade it as widely as you can to people you feel might benefit from this, because we're here and I'm ready to receive your request for support.
Brilliant, that's really useful. And just to add to that, so I will be circulating anything that kind of Ian shares with me. I'll send it out through to you via email. Excuse me. The session's obviously also been recorded. I'll send a link through so that if there's something that you think was mentioned before and you want to revisit it, that link will also go out, and you can use that as a resource yourself as well if anybody wants to kind of sit down and go through all the slides and things of that nature. Is there anything that any of the presenters wanted to mention before we kind of draw it to a close, just to give the speakers a bit of an opportunity to offer any last thoughts or observations?
Okay, Emily.
Yeah, I was just going to say, yeah, I would just sort of reiterate what Ian said. Do feel free to either contact myself or Georgie. We've put our emails in the chat, but I know they are going to be sent out as well afterwards. If you are interested in those sessions for your staff teams, or you just want to discuss any further about any of the further support we can provide, and those sort of like information sessions for people, then we can do those. So just, yeah, don't hesitate to get in touch with any further questions at all. That's absolutely fine.
And I'll add in there, apologies from my end at the start with the internet. So sorry I cut out, and thank you, Emily, for taking over. Nightmare. But also as well, repeating what Emily said, and if also you feel like maybe promotional material may benefit you to have in your staff rooms, just so it's there on the wall or on the table, anything like that, we can support with that as well. We do have those resources too.
Thanks, Georgie. And Vary?
Yeah, pretty much the same. Thank you everyone for listening, and of course you can drop me an email if you have questions regarding the workshops, or if you want to negotiate kind of a workshop that you have in mind, and also for promotional materials that we can post to yourselves for staff rooms and yeah, waiting rooms.
Okay, and then just from me, just to finish, just to let you know that I will make sure that all of you have access to my colleagues' email addresses, so that if you want to make any further questions or direct inquiries, you can do immediately. And thank you for your time.
Brilliant. Thank you, Ian, Vary, Emily, and Georgina, particularly Emily, for stepping up at the last minute. So thank you everybody for sort of your really, really useful questions. I think you helped drill down into the service and explore some of the questions that some people might have felt a little bit apprehensive about asking. So what I'll do is I will stop recording now,